Hi friends, Peter Uselak, the Embryo MD here. In this video, I want to talk to you about giving you some perspective on endometriosis and how endometriosis wears many different hats or is presented in many different ways. And what I want to do here is kind of think back to how physicians kind of learn about medicine. And I suppose it's the same in other professions as well, where you learn by perspective. So what I want to present to you here in this video is a big picture perspective on endometriosis to understand more about its presentation. And what I'm going to do is define what I call the two bookends of endometriosis, meaning the spectrum of how it can present in one way and then how it could present in a completely contrasting way to that. And so you could have either of those presentations of endometriosis, and you can also have anything in between. So let's start out with one common scenario of diagnosing endometriosis, one well-known way that endometriosis presents. That's sometimes known as silent endometriosis. So what that means is that a woman would not have any really of the classic symptoms of endometriosis in terms of pain, but if one were to look with a laparoscope, so that's a surgical instrument, inside the abdominal pelvic region, one would see the implants or those blisters associated with endometriosis around the area, and then that would make us know that there was endometriosis. We would typically excise those or get rid of them, and then finally look under a microscope and see that, yes, indeed, that is endometriosis, and that's how we make that diagnosis. So visually, the disease is present. Symptom-wise, in terms of pain, it's not present, and so that's how we come up with that term silent endometriosis. Now, it's not really completely silent because you have fertility problems, right? And that's the presentation that we usually see. In that sense, it's not really silent. There's a problem there, but there's no pain. That's the point. So think of that as bookend number one, okay? There's no pain, but endometriosis is visually there. Now, let's go to the other end of the spectrum, and let's talk about a situation where a person has significant pain. There's a lot of things historically that look like endometriosis: cyclic pelvic pain, maybe some associated gastrointestinal complaints, an associated family history, some bladder problems around the time of menses. So a lot of little clues. We do a surgery, we do that laparoscopy again, nothing. Everything looks completely normal inside. There's none of those classic blister lesions. There's no anatomical distortion. That means like organs aren't shifted around. That could suggest some scarring from the past. There's no visible scar tissue. We call that adhesions. None of that is present. It doesn't mean endometriosis isn't there. In fact, the first question I would ask if someone had laparoscopy and the surgeon reports no endometriosis is I would say, did they do some random biopsies? Just take some tissue. It's very safe. They can take a little bit of tissue and look for endometriosis. Was it present? Because sometimes you'll mask it that way. But even if that wasn't done, you could have a situation where you have endometriosis and it's only present at the molecular level. So you would never see it with your eyes, and you certainly can't biopsy forever. So the only way you would discover that is if there was another marker, what we call a surrogate marker. So maybe some way of inferring that there's endometriosis there because there's some inflammatory changes, something we can actually quantify and pick up, but there's no visible changes. So we do have that marker, actually. It's called BCL6. And BCL6 is something that's expressed in the uterus. This is inside the uterus where the endometriosis is not. If that marker was elevated and you had historically these kind of high pre-testing probabilities that you would have this disease, but it wasn't there, that would be another way that you could diagnose it. So it's not a visual diagnosis, but it'd be kind of more at the molecular level through this uterine test. This is accomplished by doing a uterine biopsy, taking some tissue from the inside of the uterus and looking for this marker, BCL6. That should give you a pretty good picture of, again, what I term the bookends, right? So on one end, no pain. We take a look surgically, we see disease. So the disease is clearly there, but the person has no symptoms. On the other end of the spectrum is classic symptoms, classic histories, classic family histories, but nothing there. And so that's why this disease of endometriosis is sometimes so puzzling. And that's why it's associated with delayed diagnoses of up to 8 to 10 years, is because it comes in many, many different forms. It's not a kind of one-size-fits-all disease. The way it presents can be quite different. The way it's diagnosed can be quite different. So think of that big picture perspective when you're considering endometriosis. It doesn't fit nicely into these little pockets. It can have a vast array of presentations, and think about those bookends as you try to kind of contemplate whether you may be suffering from endometriosis, that it may be somewhere in this wide spectrum. So I hope you found that useful. And if you did, please give me a thumbs up on this video. And please don't forget to subscribe to my YouTube channel, The Embryo MD.